Erectile dysfunction (ED), when a man has trouble getting or maintaining an erection, can feel embarrassed to talk about it. But it is very common. More than 30 million people in the United States have suffered from this sexual problem. Although it manifests itself mainly in the nether regions, research shows that the causes of ED can be emotional or systemic and physical. The best erectile dysfunction treatments can include natural remedies, such as changes in diet and alcohol consumption, and medications prescribed by a doctor. Erectile dysfunction (ED) occurs when a person with a penis is unable to get or maintain an erection. ED is more common in people who older. You have health conditions such as diabetes or high blood pressure. You have had an injury to the spinal cord, penis, or pelvis. Take medications such as antidepressants or blood pressure medications. You have anxiety or stress. Are overweight. Smoking. Treatment for ED depends on the cause. This may include prescription medications, vacuum devices, or surgery. But lifestyle changes and other natural remedies can also help improve ED. So watch the video until the end to know the solution to the problem of erectile dysfunction. Best 9 natural treatments for erectile dysfunction. 1. Diet. Eating a well-balanced diet may help maintain sexual function and reduce the risk of erectile dysfunction. A 2020 study found that men who strictly followed a Mediterranean diet, or an alternative diet for the Healthy Eating Index 2010, had a lower risk of erectile dysfunction. In particular, they consumed less red or processed meat and primarily ate the fruit, vegetables, legumes, nuts, fish. Research conducted in 2017 similarly found that eating more fruits, vegetables, and flavonoids lowers the risk of developing ED in men ages 18 to 40. These foods are important to your overall health, so helping to maintain or improve your sexual function is also a win-win. If you would like to make a video about the best foods for erectile dysfunction, tell me in the comments. 2. Exercise. Research suggests that physical activity may help protect against and improve ED. It may be especially effective if obesity, inactivity, or cardiovascular disease, among other conditions, are contributing to your erectile dysfunction. Research from 2018 found that moderate to vigorous aerobic exercise for 40 minutes a day, 4 times a week for 6 months helped reduce ED. This includes exercises such as he ran, brisk walking, cycling, swimming, skiing. Physical activity helps improve vascular health, reduce stress, and raise testosterone levels, all of which can help with ED. 3. Sleep. It is important for your overall health to get enough sleep each night. Sleeping regularly may also improve your erectile dysfunction. A 2017 study found that men who work night shifts and who reported worse sleep quality were more likely to have erectile dysfunction. Research from 2019 also indicated that people with a sleep disorder have a higher risk of developing erectile dysfunction. Other research has linked obstructive sleep apnea with an increased risk of ED. Not getting enough sleep can lower your testosterone levels, which can contribute to ED. A persistent lack of sleep is also associated with conditions related to erectile dysfunction, such as diabetes and high blood pressure. 4. Weight loss. Weight may be another factor in ED. According to research from 2020, ED was significantly more common among men who were obese, who were overweight, or with a larger waist circumference. If weight is contributing to your erectile dysfunction, exercising and eating a balanced diet can help you lose weight and improve your ED. 5. Psychotherapy. In some cases, ED results from a combination of physical and psychological problems. This may include fear of failure, religious beliefs, and sexual trauma. ED can lead to additional mental health problems, including emotional distress and low self-esteem, which can exacerbate ED. Treatment may help address these issues to improve ED. According to research from 2021, psychological interventions such as cognitive behavioral therapy, CBT, were particularly effective when paired with ED medications. Mental health interventions may also be effective, but more research is needed. A small 2018 study involving 4 weeks of mindfulness focus group therapy suggested that this type of therapy may help improve ED and sexual satisfaction. More research needs to be done to determine the most effective type of psychotherapy for ED. 6. Sexual therapy or marital counseling. About 10 to 25% of men with ED have no known risk factors. This condition, known as inorganic ED, may be caused by a mental health condition such as depression or by feeling anxious when having sex. A small 2020 study found that cognitive behavioral sex therapy, CBST, and medication were effective on their own in reducing non-organic ED. In addition, CBST was more effective in reducing anxiety among study participants. It may also be helpful to attend counseling with your partner to help them understand your condition and to discuss ways to support you. The American Urological Association has developed a guideline for treating ED based on a review of studies. The association recommends speaking with a mental health professional, especially with your partner, and says therapy can improve communication between couples and help them integrate ED treatments into their sexual relationship. 7. Reducing stress. Stress and anxiety are often associated with erectile dysfunction. A 2019 study found that stress was a major predictor of ED, along with anxiety and depression. The study suggests that chronic stress may affect testosterone or cause sleep deprivation, which may contribute to ED. However, other research indicates that the effect of stress on ED remains unclear. A 2020 study found no association between stress and ED. Until more is understood about stress and ED, it is still helpful to reduce stress in your daily life to improve your overall health. 8. Reduce alcohol. Studies have shown mixed results for the effects of alcohol on ED. Research from 2018 found that drinking moderate amounts of alcohol, less than 21 drinks per week, as defined in the study, was associated with a lower risk of ED. On the other hand, regular and high consumption did not significantly affect ED. However, other research has linked alcohol use to ED. A 2018 study found that sexual dysfunction, particularly ED, was common in people with alcohol dependence syndrome. In addition, research from 2020 also identified alcohol as a risk factor for erectile dysfunction. More research is needed on the role of alcohol in ED. The Centers for Disease Control and Prevention (CDC) recommends that men consume 2 or fewer alcoholic beverages per day. 9. Quit smoking. Smoking is another behavior that is likely to contribute to ED. This may happen in part because smoking can damage blood vessels and prevent enough blood from getting to the penis for an erection. Smoking may also reduce the availability of nitric oxide in the body, which is needed to relax involuntary muscles and increase blood flow, which plays a role in erection. According to research from 2015, frequent smoking has been associated with an increased risk of erectile dysfunction and an increased severity of ED. Some of the damage caused by smoking may not be reversed. However, the review concluded that smoking cessation, especially for men younger than 50, may help improve ED. Quitting smoking is difficult, but there are many resources available to help. Smoking cessation has the potential to help with ED and benefit many other areas of your overall health. Summary: ED is a common condition that can affect trust, relationships, and quality of life. The most effective treatment depends on the cause of your erectile dysfunction. However, natural remedies may help improve your ED and your overall health. It is best to talk to your doctor about ED. They can help determine which treatments are right for you. It may also be helpful to work through your condition with your partner. Remember that treatment can take time, especially lifestyle changes like losing weight and getting more exercise. Work with your doctor to find the treatment or combination of treatments that works best for you. If you like the content, do not forget to subscribe to the channel, like the video, and write in the comments about any topic for which a video was created. And share this video with whoever deserves to benefit from it. Wait for the new videos.